Hi, Monica. Thanks so much for having me.
You're very welcome, and thank you for coming. I know you have a lot of information um, about insurances and some of the things that are being offered. So, Patricia is an insurance specialist. You want to tell them a little bit about what you actually do, the services you provide?
Sure. Thank you, Monica. I specialize in over 65 healthcare with supplemental to Medicare and Medicaid. What we do is we offer an analysis of your current health care, compare it to every plan in the area with your doctors, your medications, and we simply tell you what we find out. Sometimes you are, in fact, you're already in the most suitable plan for
Hmm.
you,
Hmm.
and we're happy to tell you that as well.
Hmm.
We really take very seriously the healthcare. Because it's a very serious issue. And I know that people are inundated with phone calls year round
Yeah.
about, oh, well, you can get this and you can get that. And they can switch you right over the telephone.
Hmm.
So it's an interesting time, especially now with the COVID and with people being more open to do things over the phone and not so many home visits. We used to do a lot of home visits, and you would really get to know the person and get a sense of what their needs are.
Hmm.
And we're not really able to do that anymore. But
Hmm.
I think it's more important now more than ever that people are in the right plan with the right benefits, particularly during this time
Hmm.
with all of this COVID pandemic. And there's a lot of confusion and a lot of calling and promises and switching and OTC and this and that. And that's all great.
Hmm.
But I think the level of healthcare is more important and what the
Yeah.
actual plans are offering.
Yes. It's absolutely true.
Yeah.
It's absolutely true.
Yeah, because
So,
sometimes people are told, oh, well, you can get $125 and you can get this and you can get that. And then come to find out when you try and use your plan, the copays are out of control,
mhm,
or your doctor doesn't accept it, or your medication is not in the formulary. So these are really important things.
mhm,
So one of the things I would say was be really careful. And we're happy to do the evaluation for anybody, and we're happy if we can find you a plan, and we're happy if we can't find you a plan because you're in the right plan. The
right.
most important thing is that you stick where you can get health care in your area with doctors that you like.
Hmm. How important is the network?
Oh, the network is extremely important. Lots of times what happens is people will sign you up on a plan that says, oh, it's a PPO, you can go in network, you can go out of network. That that's not always necessarily true.
Hmm.
You will come across some co-insurance if you go out of network. So the network is extremely important. You want to make sure that the local hospitals are in network with you. What you don't want to do is go into a hospital, you need something done, but it's all going to be out of network, or now you have to move to another hospital. So it's very important to make sure that the hospitals that are in your area are in your healthcare plan,
Hmm.
as well as plenty of doctors, plenty of walk-in clinics. Another thing that's important is the COVID vaccine.
Mm. Hmm.
Well, the COVID testing, you want to be able to go and get tested,
Hmm.
but the vaccine, most of the healthcare carriers are offering a zero copay for that vaccine. Now, I don't know when it's going to be available to regular folks, but that's something that people need to know in case they're afraid to get it because they don't know how much it's going to cost.
Hmm.
And many of these healthcare carriers offer assistance with all of that, where to go, set up the appointment for you. So there really is a lot being offered, as well as I think we all know about the Skyping with the doctor
Hmm.
appointments,
Hmm.
but there also is available, which a lot of people don't talk about, where they can send a doctor to your house to take blood work. I mean,
Mhm.
that is also a benefit that is available on many plans. So if you're someone who really doesn't want to go out of the house, and for, for good reason at this point,
Yeah.
some healthcare carriers do provide that.
Mhm. So do you think it's important to also look at um, the services that you're specifically in need of? Because not everybody needs the same thing. So specialists or um, that's also a factor when you're choosing a plan.
Absolutely. I
Yeah.
mean, again, the network is huge. If you have to make copays, if you don't have a status of Medicare and Medicaid, you do have to make copays.
Hmm.
Sometimes a specialist copay can be, I mean, at the minimum, it's $35 to $40. So you really want to look at that. You want to also look at MRI copays, CAT scan copays, hospitalization copays, and
Hmm.
coinsurance.
Hmm.
That's very important. And additionally, if you are in need of dental, let's say you need dentures, there are certain plans. Now, most of these plans said, oh, yes, we offer dental. Well, try and find a dentist in your area. I mean, you
Hmm.
have to really know that, okay, they're gonna give you dental, but you're not going to be able to find a dentist. So
Hmm.
that works for you. I mean, nobody wants to travel 45 to 50 minutes to go to a dentist.
Hmm.
So that's another thing to consider when free dental is thrown out there. Now, some plans are known for their excellent dental, covering full dentures. Other plans are known for hearing aids, $3,000 for hearing aids, which is probably just about what a hearing aids will cost. So when you see a plan that's going to give you $1,000 for hearing aids, that sounds good, but hearing aids are a lot more money than $1,000.
Hmm.
So it's really important to communicate with someone who really knows what can really read this to you and explain it to you in a way that it just doesn't look great, but that you can really pick through it and understand what it is that you're signing up for and what the ancillary benefits are.
Hmm.
And there also are plans that offer transportation, which is very nice for folks that have to get out and go to the pharmacy. Some of them even will take you to the gym. Um, They'll take
Oh,
you to
wow.
doctor's visit. Yeah, yeah, yeah. I thought that's a great perk, because for a long time they just did it for approved doctor visits,
Hmm.
but staying healthy and staying active, or the YMCA, that's really important.
Hmm.
So they want to help that. They want to promote that and make it easier for people to get to these places.
Hmm.
So that's a really great benefit that they have. And then there's the OTC, the over-the-counter card, which is, which is not really a new feature, but more and more plans that aren't just Medicare and Medicaid are offering that now, which is great. And that's for your creams, vitamins, supplements, aspirin. There's a catalog of it, wraps, braces,
Right.
any type of thing that you might need. And what was new and started last year, which I thought was a fantastic idea, was some of the healthcare carriers, in addition to offering the OTC that you could use for those, toiletries, if you will,
Hmm.
they're offering OTCs that will pay for food,
Hmm.
anywhere from $25 to $50 a month for healthy foods,
Hmm.
which makes all the sense in the world, because that's what people really need on a day-to-day basis, and that's what so many people are struggling with. So I'm glad that they finally, wised up in that area and see
Uh-huh.
things that can really help people.
Hmm. If you had to offer um, advice in terms of developing a checklist of what people should be looking for when they're looking for a plan, what are your top five?
Ooh, ooh, hard questions with Monica. Okay, my top five. Well, I would say, are your doctors in it? Okay,
Mhm.
that's really important. And are they in network? I guess that's only one, right? I can't make two out of that. Are they in the network? Is seeing them you're going to have to pay more. I mean, so you want to make sure that they're in the network and that it's your doctors. Are the local hospitals in network? That's, that's very important too. And let's say you want to go, God forbid, you have a serious issue and you want to go into Manhattan and go to a special hospital.
Mm-hmm.
Will you be able to? Will you be able to? That's important.
Yeah.
So the doctors and the hospitals that you can utilize are really important. The next one I would say would be the formulary. You want to make sure all medications that you are taking are on the formulary. You want to find out what your drug deductible is and exactly how much your medications are going to cost you every month for the entire year. Because what happens is lots of folks get shocked when they wind up in what's called the donut hole, where all of a sudden everything is 5 times more than you were paying before and you don't know why.
Right.
So you want to know exactly for the entire year with no surprises what this is going to cost you. The other thing I would say, is there a health deductible on my plan? That's another little sneaky thing that kind of can, sneak up on you at a bad time. And health deductibles on plans would kick in at a hospitalization, at an MRI, and these are already expensive co-pays. So some of these deductibles can be $800 to $1,000. So you really want to make sure there's no health deductible on your plan. And you also want to make sure that, I mean, some plans for an MRI or a CAT scan or even durable medical equipment, they charge you in a percentage. So you don't know what your copay will be. It's 20% of, we don't know.
Right.
I'd rather have that flat rate and know. So I think that those would be, I think I made 5. I think that those would be that would be really important. And then after that, any extra benefits. I mean, unless of course you you need something like dentures, or I mean, that's important too. If people need dentures, and there's plans that will give you dentures. There's also plans that will give you a home health attendant for 4 hours a day. I think it's up to 30 visits through the year, which is really nice because you don't have to meet those state standards of needing home help. Some people just need a little bit of help around the house, a little bit of help doing chores. And there are plans that offer that as an extra benefit.
Right.
So that's really nice. They also offer, some of them will offer pest control. Some of them will offer, if you have a service dog, they'll give you $500 towards the care of your service dog, the expenses. Some of them offer to come in and put maybe handrails in your shower. So it really pays to talk to somebody who knows all of the plans, because getting the free Fitbit or the OTC card, it's helpful, but you have to make sure you're not giving up something much more important for that.
That's why I was asking the question, because so many people chase, how much is it going to cost me every month? Or, what am I going to get out of it? So I thought that was really important, that you lay all of that out, because people really don't think about those things.
Right.
Choosing a plan.
Well, and then there's, there are some people that are calling them and they're making it sound unbelievably great. And unless you specifically ask them these questions, they're not going to lie, but they're not going to go through the entire summary and say, now, if you go to the hospital, this is what's going to happen. That's also people who just run with just plain Medicare and a prescription drug plan. What they don't understand, I mean, that's all fine if you're just going for regular doctor visits, but if you wind up in a hospital, you're going to have a big fat 20% copay,
Mm-hmm.
20% of I don't know what. So that's something that and not everybody can afford, these expensive supplements that pick it up, but there
Right.
are a lot of really good options which cap any liability for you
Mm-hmm.
and offer you the dental and the vision and the hearing and the maybe some transportation. It's a very personal thing. And lots of times people will say, well, all my friends are on this,
Mm-hmm.
but you're not all on the same medications and you're not all having the same
Mm-hmm.
health issues. So you really have to be super careful and not believe all the television commercials that come on that you can get this and you can get that and it's so easy. And then when you actually call, they're like, oh, well, that's not you,
Mm-hmm.
so, and then
Mm-hmm.
they'll try and sell you something else. So
Right.
you got to
So
be
would
careful.
you recommend for someone, because you're dealing with seniors primarily, would you recommend that they kind of jot down a list of the things that they need to ask when they're
Absolutely.
looking for a plan?
Absolutely. I would ask those questions. I would ask about the hospital. I would have all my medications ready and I would want to know the cost of the entire year, not just, the first month. I would want to know about deductibles. I would want to know about co-pays. I would want to know about the MRIs, the hospitalization, the specialist. Lots of times with these PPOs, they'll tell people, well, you can go to any doctor you want. It's a PPO, in
Mhm,
network, out of network. It'll cost you $5 more to go to your specialist.
mhm,
That's at a visit. But if your specialist wants to do a procedure, now we're talking a lot of money. So you have to be really, you have to kind of think ahead of the
mhm,
what ifs. I mean, as an insurance agent, my life is about the protecting people from the what ifs. So
mhm,
I always kind of look at the worst case scenario because I want to be very clear with people. This is what could happen because I don't want anybody to call me up and say, hey, this happened and I'm shocked and I didn't know. And so
mhm.
you really have to think of, as an agent, it's your job to think of any and all scenarios that can hurt this person.
Are you based in the New York City metropolitan area?
I am actually licensed in about 8 different states. I have a very large book of business in New York. I do well before COVID. I spent my days running around all the boroughs,
Mhm,
Staten Island
mhm,
Day, Queens Day, Brooklyn Day, Bronx Day.
mhm,
But with COVID, I really can't do that anymore. So they've made a lot of different concessions for us to do things by Zoom, by phone, by mail, by text. So they've made
mhm.
it really easy because they want our seniors to stay safe. And the last thing I want to do is, go into someone's home or meet up with someone and they get sick or I get sick or, so we really have to kind of distance ourselves from the seniors. So we do a lot of mailing, a lot of overnighting, a lot of
Mhm.
Skyping, a lot of texting, a lot of but I am, and I'm, like I said, I'm licensed in 7 states, so I have clients everywhere, but the bulk of my business is in the metropolitan area because that's where I'm from.
Mhm.
I'm a
Okay.
Queens girl.
Same here.
Yeah, that's why
So
we get along so well.
absolutely. So how could someone get in touch with you if they wanted to
Just a little consultation. Oh,
yeah,
well, they can email me, they can call me, they can go on my website. Do you want me to tell you my number? Do you have it up?
absolutely.
Okay, my number is 631-245-4554. That's 631-245-4554. Patricia Hardy Insurance. I have a website, patriciahardyinsurance.com. I just wanted to say one other thing. There is, because of natural disaster, which was, I believe, the hurricane and the COVID combination, they have extended the open enrollment for
Oh,
Brooklyn, Queens, Nassau, Suffolk, Richmond County, Staten Island, um, I think that's it for the boroughs. So
Okay.
they've extended that till the end of the year. But don't worry, even if you don't, if you're not in one of those boroughs, there are other ways that you can change. Especially from January through March, we have what's called OEP, where you can
Okay.
make a change. There's also, I want to just mention, if you're not getting extra help with your prescription drug copays and they're very high, there's a wonderful state program called EPIC, New York State Pharmaceutical Plan, Savings Plan for the elderly. And it doesn't replace your prescription, your insurance. It's in addition to,
Mhm.
and that's really very, very helpful. I think you lost me. I'm
Yep.
back. Um, it's very, very helpful for lots of folks who are on these high tier medications and these inhalers. I mean, the number one thing I hear is the inhalers are so much money. Those puffers, they're like $47. There's deductibles. So that's something that that helps a lot of people. And I usually put all my people on it. It doesn't cost anything.
Mhm.
If you're over 65, if your income is under $88,000 single, $100,000 married, and you have Medicare A, B, and D, you're in. That's it. And you're entitled to it.
Mhm. And do you know if there's a monthly fee attached to Epic or
Well,
um
there's two different ways. There's a fee schedule and there is a deductible schedule. Now, the fee schedule is really, it's very small depending upon your income. You could pay it quarterly. Let's say the fee is $50 for the year. You could pay it quarterly. But here's what you get. The minute you make that first payment, they will pick up your prescription drug plan premium and the Epic schedule of copays kicks in immediately. You will
mhm.
not pay over $20 for any medication copay that's $50 or more.
Mhm.
So some people have copays that are $100.
Mhm.
That will be sliced right back down to $20
Wow.
plus, and it gets lower and lower. If they ask you for 20, you pay 5. If they ask you for
Mhm.
30, you pay 15.
Mhm.
So there's a benefit to being on that. Plus they'll pick up a portion of your if you have a plan with a premium, they'll pick up to $42 of it.
Mhm.
So you won't have to pay for your prescription drug plan. And that allows a lot of people to go on plans with a monthly premium,
Mhm.
which lowers your copays
Mhm.
and not have to pay it. So it's really a very beneficial thing. And if nothing else, I mean, and also what they do when you fill out that application is they kind of automatically check to see if you're eligible for a low income subsidy.
Mm.
So it's kind of killing two birds with one stone. Oh, and one other thing I wanted to mention, Monica, which is for the first year, they, for a while, there's been a lot of what they're called give back plans where they reduce if people have to pay their Part B, which is like $148 a month now for Part B.
Mhm.
If people have to pay that, they have been plans around for a while that they give you a reduction in that Part B. So they'll take $50 less or $40 less. Well, but in the past, the problem was there was an $800 to $1,000 health deductible on that plan. So
Mhm.
the extra $50 in your pocket, you're going to spend that really quick. And
Mhm.
then when you go to a hospital or you get a CAT scan, you're getting slammed with a deductible on top of that big fat copay.
Mhm.
This is the first year ever that I've seen a plan that gives back $70 a month in your Part B and has no healthcare deductible.
Mhm.
That helps a lot. I mean, it's
Mhm.
not right for everyone. It would have to be investigated, but
Mhm.
it is something that if you're not eligible for a Medicare savings plan where they don't take that money because you make just a little too much money,
Mhm.
that could be another good way to go.
Mhm. Excellent.
Yeah.
Anything else new for 2021? in
Well, for
insurance?
2021, what I'm seeing is they've really stepped up their game with the at-home services.
Mhm,
And that's something that I think is very important, that you should be able to have somebody, like I said, come to your house and draw blood. You should be able to do these virtual visits with doctors with much ease. The teledoc, they call it.
mhm,
I've also noticed that there's some plans that are designed right for people that are on insulin that are going to alleviate that huge copay.
mhm,
I've seen a couple different plans come where they, if it's a tier 5, which is very expensive, they've capped it at $27 copay. So I've
mhm,
seen them really kind of, oh, one other thing that's huge is people that are on Medicare and Medicaid, usually when they have these dual plans, it's an HMO. You need
mhm,
referrals. You need to go back to your doctor. You need to stay in the network. There's a brand new plan out that's been super successful this year that is a PPO. No referrals, no networks, no copays. Yeah. So that's new.
mhm,
Yeah. And
mhm,
that's a really good one too.
mhm,
But like I said, if you just want to make sure that it's going to encompass everything you need for your health care.
mhm.
And I would just say be really careful with, because, there's always the good and the bad. The good is that they've made it easier for people to enroll in plans and change plans over the phone and via text because of COVID. And that was a good thing. But the flip side of that is it's really easy for somebody to change you out of your plan over the phone, and
Right,
then you never hear from them
right.
again.
Mhm,
So have to be careful, have to realize every good advancement has some kind of little negativity to it.
mhm,
So you
mhm.
just be cautious. If anybody can call me anytime, I will look at your plan for you. I will hear you out. I will tell you what's available. And if it's something that makes sense for you,
Mhm.
I'll say, yeah, you should do it. But if your plan is the right plan, I'm going to tell you the truth about that, because you don't want to switch just to switch.
Mhm. We greatly appreciate you coming on the show today
I
and sharing
appreciate you having
information.
me.
We would love to have you come back
I
and
would love to come
uh,
back.
do some more informational, possibly a workshop
Oh,
uh,
I'd love to do a workshop.
about just overall, you had an opportunity to kind of touch on everything, but specifically to different areas. Have you come on and just speak at length about different areas, because people have so many questions about insurance and whether they're making the right choices, whether it's going to benefit them, whether it's going to
Right.
meet their needs. So,
Yeah. And how do you trust that person on the phone?
right,
Yeah, you don't know. You don't know these
right.
people. You don't know if they're telling you the truth, if they're not. So they make it it is made so confusing. I don't know why they can't simplify the whole Medicare, Medicaid thing.
Hmm.
I don't know.
Hmm.
But I would love to do that. And I would love to answer any and all questions or concerns that anybody had. You're not bothering me. That's what I do. I love to hear from you. So anytime.
Thank you very much.
All right. And no obligation with me, no cost. There's no cost for my services or anything like that.
Thank you for sharing that.
Okay.
So we can get in touch with Patricia Hardy. She gave her telephone number. We're also going to share her information on the Interconnections Facebook group page, YouTube, and again, thank you for joining us.
Monica, thank you. So great to see you.
Good to see you too. Be safe and be well.
You too.
Okay, bye-bye.